Thank you. We're moving on with Council Member Yeger for question.
Thank you, Madam Chair. Good afternoon, good morning.
Afternoon.
Whatever, we're afternoon now. You've spoken a lot about transparency and how much you support it, but you also don't like this bill. I'm just trying to understand through listening to you today, what exactly about this bill is problematic, because it really doesn't require any member of your association to do anything differently than they're currently doing. The transparency and the information that would be posted would be based on publicly available information. The information is already out there.
Our concern is how they would interpret the publicly available information.
So your concern is that if we put this up on a website, people are too stupid to get it.
No, my concern is that
you're here to protect us.
No, my concern is that the federal government says 70% of hospitals are compliant, and other groups using who knows what criteria are saying only 6% are. That's a real problem for us.
No,
We'd like to know the criteria that they would use to judge hospitals and grade them on, they have 3 grades that the federal government doesn't use in terms of compliance. The federal government says you're either compliant with our rule or you're not. The bill says transparent, satisfactory, or not transparent. We have no idea what criteria they'll use for that. And that's one of the concerns that we have.
Okay, so you don't have a problem. I'm just trying to parse out, it's a bill, right? It's a draft, and at some point, you can be guaranteed it's going to be adopted. It's got a supermajority of the council, not me, but a whole bunch of other people, enough to pass it. At some point, this bill is going to pass. I'm trying to understand which parts you have a problem with, and you certainly can't have a problem with creating the Office of Healthcare Accountability that would provide recommendations. How bad can that be? It would audit city.
I would be better if the name does not reflect the bill.
So we got a problem with the name.
No. I like the name. The problem is the underlying bill focuses almost exclusively on hospitals. There's a lot more to healthcare and healthcare costs than hospitals.
Well, let me get to the next part of what the office is supposed to do. It's supposed to audit city expenditures on healthcare. And that's not exclusive to hospitals. It's overall how much is the city paying for healthcare? It pays a lot of money for healthcare. Kind of want to get a bang for the buck, but it doesn't implicate necessarily. Unless you're concerned that there's something that we're going to find out that you don't want us to, it doesn't implicate the hospitals at all. The hospitals don't have to do anything. We're going to take information that we already have as a government. We're going to cobble it all together, make sure that there's one centralized office that has it. That office is going to create a website. It's going to make sure that there's a singular focus by an individual with a team who report directly to the mayor, who are going to be in a position to try to figure out whether or not the city is paying what it ought to be paying. Maybe it's paying too much, maybe it's paying too little. Your hospitals can make some more money. Well, let's try to find that out. I'm just trying to understand, and I'm not trying to be dense here. I just don't get the objection. I just don't understand it.
We don't have a position on the audit.
Okay.
Although OLR had a position on the audit, we don't have a position on the audit. What we have a position on is taking federal rules and regulations and then potentially reinterpreting them in ways the federal government doesn't recognize, doesn't enforce against hospitals, or creating different standards than the laws that the hospitals are supposed to be following under federal law.
Okay, but I want to be clear. This is not an enforcement bill to the extent that there are penalties involved. Nobody's getting punished. There's no fine. The city's not imposing a fine on a hospital that doesn't do X, Y, and Z in compliance. It is simply taking information and putting it in the public domain so that members of the government, people who are supposedly on the board of directors of this municipal enterprise, and also the general public can have an opportunity to see. If you're saying that the people are not, able to understand it, well, that's okay. There's a lot of information on websites that we don't understand. I don't understand it. That's fine. But I just don't get the objection, because the hospital doesn't have to do a single thing if this bill passes, other than continue to do whatever it is that it's doing. All that will happen is that the city, the payer, the customer will have a little bit more information, and I think more information is always good. I guess that's not a question, so anyway, I appreciate you being here. Thank you very much.
I believe it or not, I'm in agreement with the statement that you made. It's just like we're not regulating. And I said that many, many times. We are just here to look for transparency. There is no regulation. This is not our land, and I love to stay in my lane. So I'm staying in my lane. It's just transparency, make it more accessible to the people that we serve. That's all. So having said that, I want to say thank you. Anyone else?
Thank you.